नहीं चेक पे आएगा, मैंने ऑप्शन दिया हुआ है ना, वो आपके पास आएगा।
ऊपर स्क्रीन पे जो पहले दिया हुआ था ना चैट का ऑप्शन, वो नहीं आ रहा, सिर्फ स्क्रीन शेयरिंग आ रही है।
मोर का ऑप्शन आ रहा है, वो तो होगा जब आपने फुल स्क्रीन किया। हाँ वो जाएगा यहाँ से, ये आ गया, देखें। ठीक है सर, नहीं आपने ये किया ना, ये ऊपर चले जाता है। हाँ हाँ ये तो मैं देख लूँ, ये क्लिक करूँ तो नेक्स्ट स्लाइड आ रही है ना, ये कैसे आ रहा है? जब इस पे जाएंगे ना, अरे तो ये नजर ही नहीं आ रहा ना मुझे, आप बताइए मैं कैसे जाऊँ? इसके ऊपर रखना है बस यार, ताकि ना सब आ जाएगा। ठीक है स्टार्ट करना है क्या? जी मैडम स्टार्ट करें।
स्टार्ट करें। अस्सलाम वालेकुम एवरीवन, आई एम डॉक्टर शफक, आई एम सीनियर रजिस्ट्रार इन सर्जिकल यूनिट 1. Today we will discuss a very important topic in the surgery, that is examination of the swelling. If you have any query, you can chat me in a chat box. I will read this and will respond to you. The objective of this tutorial is at the end of the lecture, each of you will be able to list the standard scheme for any lump or swelling examination. Okay, and I will show the scheme of examination. Before any examination of any swelling, you must know the brief history related to the swelling. History, we will ask about when the patient has noticed the lump first time, what was the symptom of that lump, what causes the symptom, and what are the associated symptoms of that presenting complaint. Then when he noticed the lump, then is its size was progressively increased or suddenly increased, or whenever the lump reduces in its size or becomes disappears, or it is increasing continuously. So and one more question will ask, that is there any other lump in the body he noticed or not. After that we will ask about the systemic symptoms, which you can ask with the direct questions, and then all the history components like the family history, social history, and all that. We will complete that. For the swelling, for the skin swellings, we have a certain terms which I would like to describe you. That is, we commonly encountered with the swellings like cyst. Anyone can tell me about what is a cyst? How would you define cyst? Any one of you? No one. Fluid-filled swelling, yes. Who is this? Minha Murtaza. She is telling that it is cyst is a fluid-filled swelling, yes. Or fluid-filled space. Who is that? Navera said fluid-filled inflammatory swelling. No, it's not necessary that the swelling, the cyst is inflammatory all the time. Membranous sac. Sac means what? Membranous sac. No. Cyst may be true or false. True cyst is lined with the epithelium, and the false cyst having only the granulation tissues. Homogeneous content. No, it's a mixed consistency. It's a fluid. Okay. Okay. The cyst, it's a tumor that contains the fluid. Okay. Papilloma, second terminology we use to describe a swelling is papilloma. That is papilloma. Any one of you? If you have know about the layers of the skin or the epithelium of the skin, the layers of this epithelium, you can then easily define the papilloma. Papilloma, it's outgrowth of the epithelial tissue containing the all layers of skin epithelium. Okay? Then rounded overgrowth of epithelium. Ye aapne kiski, who is this? Sidra Musa. Rounded overgrowth of, it may be rounded, maybe not, it may be sessile or pedunculated. Okay, it's not rounded only. The tumor. What is the tumor? How would you understand with the word tumor? You can chat only. You can't respond other way. Tumor? No answer. Tumor means it's an English word. It means a swelling, but it is inaccurately used to mean a malignant swelling, but not it's necessary that it may be malignant or not. Tumor means swelling. Okay, abnormal cell growth in the aggregated form. Okay, it's correct. Who is this? This is Bushra Murad. Bushra Murad, abnormal cell growth in the aggregated form. Yes. Last term I would like to explain is the hematoma. Hematoma, I think you can, any one of you explain? Okay, let me know. And it's hematoma, it's an overgrowth of one or more cell types that are normal constituents of that organ in which they arise. It means there is not any abnormal constituents, means that the structures, the constituents here, the appendages that present in that organ, that becomes overgrown. Okay, next, this is the scheme for the examination. Everyone should learn this, the whole scheme. Every examination starts with the introduction, that is, introduce yourself first to the patient, and introduce yourself, and then ask the name of the patient. Then what you do, you should take a consent that I will tell you how would you explain yourself, introduce yourself, that like I'm Dr. Shafaq, I'm a surgery doctor, and I will examine you. Yeah, I will ask about the complaints you have and the problem या the swelling you have. I will examine that. आप मुझे इसकी इजाज़त देते हैं, ठीक है? You will ask with clear words that कि मैं डॉक्टर हूँ सर्जरी की, मैं आपकी इस सूजन का मुआयना करना चाहती हूँ, क्या मुझे आप इजाज़त देते हैं? ठीक है? You will ask that, like that. Then you, after taking a consent, then you will expose that area. Exposure is very important. Okay. What is this? Feedback. It's maybe. Exposure is very important. If you are examining the swelling or lump in the abdomen, you should expose from the level of nipple up to the mid thigh. And if you are examining the breast lump, you should uncover the patient's upper chest and along with the both clavicles and axilla. Likewise, it depends on the site of the swelling. And then fourth point is the position. Make a position in which the lump becomes more prominent, or we can easily palpate that lump. After that, we have a local examination, that is included the inspection, palpation. If the cyst or swelling is has to be percussed, it depends on the site of the swelling. Then we will do percussion and auscultation. After this local examination, we should examine the draining lymph nodes, the area of the lump where the lymph nodes drains, and the joints above and below the swelling, and the overlying skin and adjacent tissues. Any question? Any question? Anyone have to ask about the scheme of the examination? Okay, really good. Local examination includes these 4 components: inspection, palpation, percussion, and auscultation. Okay, during the inspection, we will follow this scheme, that is, you should know the site of the swelling and always describe the site with the anatomical landmarks, giving the reference of the bony points. Okay, after that, you have to describe the shape. Shape, like the solid organs are having the 3 dimensions, so it not be circular or oval. You can describe the shape of any swelling in the like it's a pear shape, or it's a kidney shape, or it's a dumbbell shape. Okay, after the shape we will assess the size. For the size we have to measure the size, not we can just we keep the that it is approximately, no approximation, the size is always measured. So during inspection we just measure the size, and then for the size we will have 3 dimensions for the lump, like we have to check the length of the swelling, width of the swelling, and the depth. For the depth, it's very difficult clinically to assess the depth of the swelling. Yes, is there any message, new message? 5S. Zenula. What is this 5S? For the scheme of inspection, I think we want to. Okay. Next, the size and color. Color of the swelling means we will compare the color to the normal skin, surrounding skins. The color may be, skin may be the discolored, may be inflamed, it may be smooth, shiny, it may be thick or rough. Yes, you are right. Size, shape. This is the scheme. You can remember for using this 5S. Okay. Color depend upon this presence site of the swelling and the presentation of the swelling. That is, if it is the inflamed swelling, that then skin would be reddened or discolored, or swelling may be having the rough surface, rough color, thick swelling, smooth and shiny. Okay. After that, we will describe the surface of the swelling. Its surface may be smooth, may be irregular, and sometimes some swellings are irregular but having the smooth surface, smooth bumps of the, for example, like the lobulated swelling, it may not be a rough, maybe having irregular surface but smooth. Size, shape, surface. Okay, for after that we will see the number of the swelling. If the swelling is single in number, or maybe associated other lumps in the body, or maybe the same swelling having the 2 or 3 in a number. Okay, for example, like the neurofibroma, in the neurofibroma there is a multiple swellings in the same area. For the inspection, then we will look for the visible pulsations and the impulse of cuffing. It is for the specific swellings, like visible pulsations. We will look for where the major arteries are present, the swellings with the in which the major arterial system is involved. Like we will see this pulsations in the abdominal aorta. Okay, and impulse on cuffing, it is for the which type of swelling? Any one of you? Cuff impulse will be positive in which type of swellings? Hernias. And other than hernias, like which hernia? Inguinal hernias, abdominal hernias. Else then? Inguinal, Navarre's in abdominal hernias. Yes. Abdominal. Okay. Is there any other site where there may be a communication with the canal anywhere else than abdomen? Maybe it may be positive in the chest swellings. Is it? Femoral canal. Okay, that is. the swellings which have a communication with the cavity, like if it is communicating with the thoracic cavity, lumps like the tuberculous swelling, it may give a positive cough impulse, okay? Else than this abdominal hernia. Other than chest swelling, it may be, yes, extra abdominal as well. Yes, I want to ask this. What is this extra? Esophageal cyst? No, that is not. We will not elicit the cough impulse on this esophageal cyst. There is the cyst which have a communication with the pleural cavity, like the tuberculous sepsis, and the cysts which have a communication with the spinal canal. It would give the positive cough impulse. Okay. Then for the inspection overlying skin, we will examine the overlying skin for the any inflammation, scar marks, or any pigmentations. Now we will discuss separately the competence of the inspection, that is the site. In the first picture, what you are saying, where is the swelling? How would you describe this, the site of this swelling? Any one of you who can describe the site of this swelling? You should always explain or describe the site with the anatomical position. Yes, with anatomical position, but how? Lateral, left lateral canthus, lateral side of the eye. Why it is here? Do you know what's the spot diagnosis? Any one of you can? Superior lateral to the eye, lateral side of the left. Usama is saying lateral side of the left eye. Lacrimal. Minha is saying lacrimal tumor. No. This is very specific site. It is the spot diagnosis. No one has tell me the spot diagnosis of this swelling. This is dermoid cyst. Do you know where the dermoid cyst is formed? Any one of you? Lateral side of left eye, lateral side left. Okay, that is that's fine. Line of fusion. Yes, who is this? Usama Rafiq is saying that. No, Sakina Mansoor is saying there is line of fusions of the embryonal bony processes. Okay, this is the fusion of ophthalmic processes. And the dermoid cyst is formed. They occur in the midline of the trunk, usually where the skin dermatome fuses. Okay, so this is, we will explain this site as the external angular dermoid, lateral end of the eyebrow, lateral end where the ophthalmic processes fuses. Okay, and this second picture, what is this? This is also the dermoid. This is post-auricular dermoid. Post-auricular dermoid, it explains its anatomy itself. Okay, post-auricular means behind the ear. What is this third picture? Meningocele. Who is this? Muhammad Shah. Meningocele. How would you tell me the site, exact site, with the anatomical position, where this meningocele is located? Obviously in the midline. Okay, in the lower back, in the midline. Okay. For this, I have mentioned you already that we will assess the dimensions in the size. Its length of the swelling, width of the swelling, and the depth. We will not actually assess the depth of the swelling clinically. So at least we will explain the swelling in the 2 dimensions. That is like 2 by 2 centimeter or 2 by 1.2 centimeter, like that. We will measure with the inch tape. Noted in the centimeters. Okay. ठीक in the lumbar region. It's not the lumbar, lower thoracic भी नहीं कहेंगे, इसको lower back है, lumbar region नहीं, in the midline. This is located in the midline. Okay, after the size, we will assess the shape. Shape कैसे बताएंगे? As I have told you that the shape this is not correct. It not be spherical. These are the plain terminology. We will describe the shape like this is the pear shape, or it's like pear shape or kidney shape or dumbbell shape. ठीक है? Not yes, it's oval kidney shape like this. Surface. What's the surface of this swelling and what are the findings in this? The second picture. Surface may be smooth, may be nodular, irregular. Okay. Irregular, yes, with the nodularity. Nodularity may be present. Irregularity like the multinodular. This is the multinodular divider, and this is the lipoma with a smooth surface. Overlying skin, that is, again, I have explained you that if there is this inflammatory swelling, the skin would be reddened, edematous, and the surrounding area shows erythema as well. These are the erythematous skin. What is this? This is that. What is the spot diagnosis of this picture? What's this looking? There is a center. There is a punctum in the center. What is this? Any one of you? No, infection. What type of infection, Rashida? Shazeen. Shazeen is saying fruncle. No. In which swelling the punctum is present? Abscess? No. This is abscess. The second picture is the picture of abscess. What is this? What is draining? What is this punctum? Stab wound. Who is this? No, beta. Sebaceous. Yes. Who is this? Anas Hashim. Anas Hashim is saying that it is sebaceous cyst. Yes, it is infected sebaceous cyst. It's not a normal skin well. It's infected sebaceous cyst having the reddened overlying skin, and this is the punctum. What is the punctum? Why the sebaceous cyst has a punctum? Insect bite. No, beta. Sayyada Laila Ahsan. No, this is not a cause it ruptured. No. Why? Yes, ruptured to hoti, but why this punctum is present? Insect bite. Follicle is blocked. Which follicle is blocked? How the sebaceous cyst is formed? What are the follicles? Hair follicle. Yes. Is this the infection of hair follicle? Infection of hair follicle is not the sebaceous cyst. That would be the folliculitis. Actually, this sebaceous cyst is involving the pilosebaceous gland. Okay, the sebaceous secretion, the sebum is secreted with the sebaceous gland. Yes, sebaceous gland. The blockage of ducts of the sebaceous gland lead to the accumulation of secretions. And when these cysts are distended, they trap with the hair follicles. So, what happened then? When it becomes infected, the secretion from this point started. The sebum will discharge from this point, and then this point of fixation pulls inward because it involves the hair follicle, so it gives a pitted appearance. Okay. Okay, in the skin, we will also see the prominent veins, edematous area, pigmentation, ulceration, any scar. Okay, this is the abscess. How the skin is looking? It looks shiny, distended, tense. The surrounding area of the skin, maybe this is the lesion, and the surrounding skin is erythematous. And what is this? This is the prominent veins in the surrounding area of this lesion. This is a malignant lesion with the prominent veins and wasting in this area. Okay, this is a swelling. Who will inspect? Who will tell me the findings on the inspection of this swelling? Start with the scheme, the site. First, you tell me about the site where this swelling is located. Then its shape, surface, edges, back in where back. Start from mid vertebral column and extending to the lateral chest wall. ठीक है, back laterally. You should have to tell the extension. It start from the vertebral column and extending to the lateral chest wall, and above it is start from the lower scapular region up to the iliac crest. Okay, like this you have to explain the site. Size, it is, we will measure with the inch tape, so we will not comment on the size. Then surface is smooth surface, smooth as such smooth, ठीक है, shiny smooth है, और shiny हो गया, smooth, okay, rounded, ठीक है, rounded. और इसका size आप कैसे assess कर सकते हैं? You can tell it's a tennis ball size, which the size you always compare with the standard size, like tennis ball or the any other which is what you say, saying this is tense, glossy, okay, shiny, tense, rounded in the center. And where is this? What is this area showing? Overlying the skin is what? Erythematous. Okay, and anyone else? Erythematous, middle erythematous, xanolizing erythematous, middle. Okay, but this is the ulcerated area. Overlying skin is you can say smooth with the edema, yeah, erythematous, and the center with the ulcerations. These are the ulcerations. Surface, okay, then edges, the edges are well defined. Okay, now tell me about this swelling. Any one of you tell me the spot diagnosis. What do you think that which is this swelling? Lipoma, yes, good. Why you are saying that Khala Farooq? Why it is lipoma? And Shazeen, Sakina, why it is lipoma? Okay, site is teak, back above the scapula, starting from the vertebral column to the left shoulder, right shoulder, back of the teak. Yes, you have. Okay, right. Side, then surface, borders, overlying skin. It has a smooth surface, and it is shape. It's a pear shape. Overlying skin is normal. Okay, compare with the normal skin. Surface is smooth. No punctum is present. No erythema. Yes. inspection in this swelling? What you are saying that we haven't discussed before? Any one of you? Scar mark, and yes, this is a scar mark. This is for the incision. Maybe he underwent the incisional biopsy or true cut biopsy. Yes, good.
There is no ballot. Examiners usually prefer to move on to the local examination. Local examination begins with inspection. On inspection, there is a single spherical swelling over right clavicular region extending from supraclavicular region up to the upper part of anterior chest wall and from right shoulder to midline, which is approximately the size of an orange.
Okay. Listen, how he has explained the side in the 2-dimension extension from above and below and medial to lateral. Okay.
The surface of swelling appears to be irregular and uneven, with a surgical incision over lateral part of the swelling. There is no visible discharge from surgical site. Visible dilated tortuous veins are present over the swelling. Color of overlying skin appears normal. Edges are ill-defined. Swelling is not pulsatile and shows no ripples on cuffing.
Okay. Are you watching these prominent veins here? This is a scar mark. And we have seen that there is no visible pulsations overlying the skin is compared with the normal skin, other than this scar site. We can't hear. Who is this? Ghulam Mustafa, you are not in. Okay, this inspection is completed. Now we will move on the okay. Okay. After that inspection, we will start the palpation. In the palpation, what we do first, we will ask the patient that is there any tender area, is there any pain on over the swelling. You can assess first the side where the patient is feeling pain. So always palpate that tender area in the last. So how will we tell the size of the swelling? Size, you will measure the size with the inch tape. You have to tell the size in the centimeters. Who is this? Uja, I think. Okay, for the palpation, start palpation then. First, you will assess the temperature of the swelling. How would you compare the temperature? How would you feel the temperature? We will use the dorsal surface of our hand for assessing the temperature. Why we use the dorsal surface of hand usually? Because the dorsum is usually dry with the no sweat glands. It's more sensitive. Okay. There is no sweat glands. It's usually dry. It's not moist like our palm having the sweats. Compare the swelling and then with the normal skin and then again with the swelling. After the temperature, check for the tenderness, and it's make a habit always try to palpate the non-tender area before feeling the tender area, and not forget to watch the patient's face. You have to check the expression of the face while assessing the tenderness. Then after this tenderness, we will confirm the size, shape and extent of the swelling which we have inspect. Then we will feel the surface. We will define the edges, like the edges are ill-defined or well-defined. For the composition of that swelling, we will assess the consistency of that swelling. We will elicit certain signs for confirming the nature of the swelling, like the fluctuation test, transillumination, impulse on cuffing. We will do impulse on cuffing on inspection and palpation both. Then C for the compressibility and pulsatility and fixity of that swelling. These all depend upon the site of the swellings. Palpation, for the palpation, we use the pulp of our fingers to examine the swelling, and we will assess the all components I have told you. Temperature, I have told you that we will compare the temperature with the surrounding tissues with the normal. Then tenderness, why the swelling is tender to touch, which swellings are tender to touch? Any one of you would like to tell? Infections, what infection? Infected ones. Can you describe accurately? Pus filled, yes. Abscess, inflammatory, good. Abscess, inflammatory swellings are tender to touch. Achha, the third thing is pulsations. What swellings would be pulsatile? Yes, Sidra Musa is saying there can be inflammation on skin stents. Yes, good. Which type of swellings have a pulsatility? Any one of you? Do you know about the true pulsations and false pulsations? Bruit, where the bruit is also the term bruit, we can see auscultate, and pulsations we can feel, palpate. Which type of swellings in which we will assess hemangioma? Arterial, yes. Vascular swellings, arterial malformation, yes. We will assess the pulsatility in the swellings which are related to the vascular arterial system. But not always pulsations are positive when the swellings start originating from the arterial system. It may be expansile pulsations or may be transmitted. So we have to differentiate. No, carcinoma may be goiter, yes. Aneurysms, good. Who is this? Minha Murtaza saying aneurysms. Okay, I will tell you now the type of pulsations. If the swelling arises from the arterial system or directly from the heart or aorta, it will be your finger will be pushes upward and outward. It means that it will extend all over. But if the swelling is present near the artery, so it will pushes your finger only upward. So this is not the true pulsation, it is the transmitted pulsations from that artery. Okay, did you understand this? Difference between the transmitted pulsations and the expansile. The true pulsations are expansile pulsations in which your examining finger would move upward and outwards. And if the swelling is present near the artery, it would only move your fingers upward. Any question? Please explain again pulsations. Yes, I have explained again. True pulsations are the expansile pulsations. Look at this picture. Your examining finger is on the swelling, and then your finger will move upward and outward. It means that the swelling is itself pulsating. And if the swelling is present near the artery, it would only move your fingers upward. Then the mobility and non-mobile swellings, we will assess this mobility by holding the lump in your fingers and then move it in the two directions, vertical and horizontal. If the swelling is mobile, it will move all around, and if the swelling is associated with the underlying structures like the muscles, its mobility will be reduced. And can give me the example of a freely mobile swelling. Lipoma, lymph node. Lipoma is not freely mobile. Lymph node, okay, lymph node maybe. Or example of the freely mobile swelling in the breast. Any one of you? if it is tender, how can we touch and check for the mobility? No, it's not necessary. If you have for the tender swelling, you will elicit the signs of the fluctuations, and then overlying skin, you have seen that there is no need to check the mobility. Inflamed swelling hai or abscess hai, you just confirm your diagnosis. It's not necessary to perform all the methods, all the signs to elicit in every swelling. Okay, I have asked the example of a swelling in the breast which is freely mobile. Anyone of you can tell? No? Okay, we'll move on to consistency. You can palpate the swelling for the consistency. Adenoma, who is this? No, adenoma. Which type of adenoma? What we call the adenoma in the breast? We'll call it fibroadenoma. Fibroadenoma is freely mobile in the breast, and it is also called the mouse. Okay, consistency, it may be hard, firm, soft, and tense. How would you assess the consistency is hard? We will compare with the standard thing, like bone. If the swelling is feeling like a bone, that is hard. Firm, we will compare with the tip of nose, that is firm its consistency, so we can compare the swelling with the tip of nose. So soft like lips, okay? And tense, it means it's a fluid filled. Any question? Now we will look for the fluctuation. What type of swellings have a fluctuations? Yes, cystic swellings can be fluctuant. So how would you perform the fluctuation test? These are the methods given in this picture. Miss, you can repeat true and false pulsations. Okay, I will just explain the fluctuation and then I will tell you about the true and false pulsation. Who is this? Mariam Batum. Okay, fluctuation. For the fluctuation, you placed your two fingers, hold the swelling with the two fingers and put the index finger in the center. And after applying the pressure in the swelling, what happens? The pressure spreads all around. It means that it is a cystic swelling with the fluid fill. If your fingers are not pulling upward, it means that there is no fluid. Finding is positive if the two digits are pushed away in both directions. Okay? Get it? Got it, these fluctuations? No. Javeria. If the swelling is tender, would assessing the fluctuation may be too painful for the patient. Tender swelling, obviously, but you have to check for the fluid. Tender swelling, it's not always necessary that tender is the soft swelling. We will have to confirm the swelling in whether it is solid or cystic, because we have to make the diagnosis. If there is an abscess which is tender, we would elicit the test of fluctuation for the diagnosis. We have to check for the fluctuation, but it's too painful for the patient, but we can assess. And it's not too painful. Look at the picture. This is not, we are not applying too much pressure on this swelling. We just touch the swelling. If it is fluid filled, it will spread all around. It's not too painful procedure. Got it? You have to just push your finger on the top of the swelling or most soft fluctuating part. You can easily assess that it is the fluid filled or not. Okay, then next is transillumination. Transillumination, we do this test for confirming the presence of fluid, which is, and in which swelling this test is positive. Transillumination test is positive in the cystic swellings which having the clear fluid. Clear fluid, what could be the clear fluid? It could be the water, it could be the serum, lymph, fluid filled. Yes, Sidra Musa, fluid filled, but which type of fluid? Is the presence of blood will transilluminate? Purulent, no. Purulent swelling will not transilluminate. Transillumination, yes, serous. You can see you can say the serous fluid. It could be the serum, lymph, water. Yes, serum, mucus. Mucus swellings are not transilluminate usually. Okay, we have to check that. Anyone give the example of the swelling in which the transillumination test is positive? No example? No one? Hydrocele, good. Who is this? Sakina Mansoor is saying hydrocele. Any more? Any other example? This is how to perform the transillumination test. It is performed in the dark room, placing the torch and assess the hydrocephalus. Okay, cystic hygroma, that contains the lymph, that is also gives the positive transillumination test. This is the way how we elicit the sign of transillumination. After the transillumination or after the palpation, we can check for the auscultation. Auscultation is not for the all swelling; these are for the pulsatile swelling. At other examination, that as I told you before, that we will see the regional lymph nodes, the draining area of that lymph, the swelling, and the joint above and below the swelling for the check for the movement and for the pressure effects. Systemic examination can we do with the relative to the swelling. Okay, I would like to now show you this video. Rashida is saying like sinusitis. No sinusitis, there is no positive transillumination test.
Examination of a swelling. On inspection, first note the site of the swelling.
Look this video, and if you have any question, you can ask.
That is the exact anatomical location and the number, whether it is single or multiple. Some swellings have a typical position which is diagnostic of the swelling. For example, a post-auricular dermoid within the ear, or a meningocele over the back in the midline, or an external angular dermoid at the lateral end of the eyebrow. Then note the number. Most swellings will be solitary, but some are typically multiple. For example, multiple cutaneous swellings in multiple neurofibromatosis or von Reckling-Walton's disease, multiple subcutaneous swellings in multiple lymphomatosis or Dalton's disease. Now note the shape and size of the swelling. The shape may be a regular one, like spherical, oval, or kidney shape, or it may be an irregular shaped swelling. Then measure the exact size in centimeters using a weight.
Look at this picture now. You have to measure the size with the inch tape. Okay, and anyone is asking that in this topic is present in Metroids or bedside? No, I have this. You can read this examination from the Norman Browse. I have taken all the slides with the Norman Browse.
During day, measure in longitudinal and transverse axis, and where possible, the depth. The depth of the swelling can be better judged on palpation, so measurement with a scale may also be done during palpation. Now examine the surface of the swelling. Does it have any characteristic color? For example, a capillary hemangioma, as seen on the forehead of this child, is bright red in color, or a malignant melanoma, as seen on the heel of this patient, is black in color. Next, is the surface smooth or irregular? Note the typical filiform branches over a papilla. carcinoma and cauliflower surface of a squamous cell carcinoma. Now note the skin over the swelling, whether it is normal, inflamed, or ulcerated. A dense, shiny skin with prominent veins suggests a sarcoma. A black puncture on the skin over the swelling is diagnostic of a sebaceous cyst.
This is punctum, but it's not the diagnostic of sebaceous cyst, but usually it's present with the sebaceous cyst. But he's saying that it's diagnostic, it's not diagnostic.
Red edematous skin over the sebaceous cyst indicates inflammation or an infected cyst. Note the redness and shininess of skin in this injection axis of the right buttock. Presence of a scar of previous surgery suggests that the swelling is a recurrent one. An edematous skin with multiple bits, like an orange peel, termed as orange appearance, suggests an infiltrating malignant blocking cutaneous lymphadenus. Now inspect the swelling for a few seconds for any visible pulsation, that is, a movement or increase in size synchronous with each heartbeat. Swelling arising from the arteries like aneurysms will be pulsatile, as seen in this aneurysm of the attending organ pulsing through the anterior chest wall. Lastly, depending on the size and type of the swelling, a few specific signs should be looked for. If the swelling is over the abdomen or chest or spinal canal.
Look at this picture. Cuff impulse is positive in the inguinal hernia. You can see the impulse and you can inspect the cuff impulse, and you can also confirm this impulse on palpation. Any question you can ask?
Ask the patient to come and look for an impulse on cuffing. A visible increase in the size of the swelling, synchronous with the cuff, is termed as an impulse on cuffing, as in this inguinal hernia. If the swelling is on the limbs, inspect the distal limb for any pressure effects.
Sakina is asking, any mass that is pulsatile should not be palpated and can only be inspected. No, we can inspect the pulsations and then we confirm the pulsations on the palpation. We have to palpate to differentiate between the transmitted pulsations and expansile pulsations.
Like edema or air pulse. Note the foot drop caused by a bone tumor in the upper tibia. Presence of pulse with each heartbeat. Lastly, depending on the site and type of the swelling, a few specific signs should be looked for. If the swelling is over the abdomen or chest or spinal canal, ask the patient to come. And look for an impulse of blocking. Increase in the size of the swelling, synchronous.
Can you give the link for the videos? Yes, I have mentioned the links at the end of the slide. You can see the link and you can watch these both videos at home and assess.
Impulse on cuffing, as in this inguinal hernia. If this bone tumor in the upper tibia. Similarly, if the swelling is on the front of the neck, look for movement on deglutition. To revise on inspection, note the site of the swelling and whether it is single or multiple. Note the shape and measure the size. Inspect the surface and inspect the skin over the swelling for inflammation, punctums, scars, or veins.
Okay. Okay, we are just having the time shortage. I am just closing now. Any question you can ask. I have a link shared in the end. These was the pictures I have taken to show you and discuss this spot diagnosis. This is infected sebaceous cyst. This is the lipoma, and this is the lipoma is usually lobulated. And how it's look like is this picture shows. These the lobulations of the fat lobules. This is the hemangioma. And it was a papilloma that I have discussed, that is the outgrowth of the all layers of the skin with the central vascular core. Okay. What is this? You can tell me. This is dermoid cyst. These are the references. These videos from the YouTube. You can just good. Who is this? No name is mentioned. This is Afreen Arif saying the dermoid cyst. Okay, these are the links for these two videos. You can watch the videos at home. No, this is not fluid filled swelling. Who is this? Rashida. This is not fluid filled swelling. It's a dermoid cyst, which usually contains the elements of the skin appendages. Any question? Any question? Thanks a lot, ma'am. Okay, thank you so much.
Okay, madam. Allah Hafiz.
Yeah.